Hey everyone, and welcome to a new episode of He's Not Wrong. And I'm your host, Chad D. And we have a very special guest for all of you today, Dr. Demetre Daskalakis. He grew up in Arlington, Virginia. And as a Columbia biology student in 1991, he volunteered during the height of the AIDS crisis. And that choice set him on the course of everything that followed. He trained at NYU, Harvard, Brigham and Women's, and Mass General. And then he spent decades doing the work the healthcare system was too timid to do. He went into bathhouses and sex clubs to test men for HIV, running New York City's COVID response in the most terrifying early months of 2020, and rising at the CDC to lead national vaccine policy and the mpox response, where daily cases fell more than 99% under his watch. When the CDC became something he no longer recognized, he left, and he said so plainly. He's now Chief Medical Officer at Callan Lord. And so without further ado, I give you my conversation with Dr. Demetre. Demetre, thank you so much for joining us today. I'm so appreciative for your time. I usually ask my guests how they're doing, but I'm just going to assume that we're all kind of living the same experience in this hellscape that is Trump's America right now.
Doing great.
For real, thank you so much for joining us. I want to get started with your work in New York City back in the 90s, because you got your start in community health, really working with the gay community and working against HIV. I'm just curious what that experience taught you as you went on throughout your career at the CDC and in public health.
Yeah, I mean, I feel like it's so important for like young people to realize that like the things that they do when they're younger are so formative for the things that they do in the future. Like it just sort of trains the system. And so that's really my story with what happened with my work in HIV. I mean, so I moved to New York City in 1991. I was 17 years old. So people can, reverse engineer my age, which is fine. So 17 years old. And I, was a little gay guy who landed in New York City, and it was the 90s. And so I like automatically just started to like go out into like what was the sort of nightlife universe in New York City. And the very first thing that happened is I would meet really interesting folks, like people that, were from like all sorts of different backgrounds, like sort of, before I had the word gender diverse, like a very gender diverse group of people from like, different sort of parts of the country, parts of the world, parts of the city, and, different sexualities, different like races, ethnicities, just everything, like in sort of growing up, sort of, like insulated in like Arlington, Virginia, around DC. This was like really eye-opening. And like very soon after I got there, I would meet people out in the world, and then I would go like, where did this person go? And the answer was always St. Vincent's Hospital or Bellevue Hospital, because they would be sick.
Yeah.
And so, like I can think about the impact, the sort of things that I've done in my career, but I do think that is probably like the thing that was the most impactful for me early in the days, which is like really sort of seeing what the impact of infectious disease, was on people. And, the people that I would lose or that I would lose track of would be people that, frankly, were folks that could least afford to sort of have this happen to them. And so that I think was such an important lesson, like your trans woman that I would be friends with because they were like fabulous, like club kids in the 90s would, all of a sudden disappear. And like, I knew for a fact that they were like sofa surfing because they had nowhere to live. And so it was, like it became very clear even as a kid that like the interaction between society, the social environment, like the policy environment, and infectious disease is the thing that can take like a little virus to something that is a global pandemic.
Yeah. Yeah. And what did it mean for your community to see a gay doctor at that time out in the community doing the work that you were doing with absolutely no shame?
Yeah, I mean, so like I'm a little later than the 90s for that. So I kind of emerged sort of in the universe of like as a clinician, in the early 2000s. And, I feel like you don't realize the impact that you're having on the community while you're doing it by just being like a good scientist and then just being yourself. I didn't realize while I was doing it that it mattered so much to so many people. I mean, thinking about, what I have now is like, I'll have like young, clinicians come up to me and say like, I've been following your career. And I'm like, that's so wild that, right, that people are like following because, I'm a good scientist. I had good ideas and
Yeah.
did some really important things in HIV and LGBT health, as well as other things later. But then to sort of see that that has impact because people can see themselves, I think it's so critical. And also, for me, it taught a lesson, Chad, about how important it is in public health to realize when you are or are not the trusted messenger.
Yes. Yes.
I've been a trusted messenger. And so my spidey sense goes off when I know that I'm not the trusted messenger for another community. And it taught me and will continue to teach me as I sort of go through sort of my universe of the work that I do, that one of the best skills that you can have as a public health scientist is to know when to step aside and
Yeah.
to let other people be the voices.
The reason why I asked that question is because right now we're seeing the erosion of trust in our public health at a level that we've never seen before. And I'm just thinking about my experience growing up in Alabama. I went to a southern conservative college, Auburn University, and there just really wasn't a lot of representation in the health services and in the science that we would see. And I'm just thinking back, I'm like, if I saw someone like you doing your work at a place where I was in Alabama, I just wonder how far we could actually go and trusting public health to an even greater extent. Seeing people like you doing the work that you do in places like Alabama. And so that's why I think it's so important to understand the work that you're doing and the trust at the community level and what that means more broadly for public health as a whole.
Yeah, I mean, I think that in general, as we're sort of like staring down people that say that diversity and sort of like diversity focused recruitment and stimulating people to sort of go into public health
Yeah.
who may not otherwise go into public health, how that's somehow harmful. Like I think that those are the people that don't understand the importance of seeing the population that you serve reflected in the people that are doing the work,
Yeah.
right? Like, I mean, when I was working in the measles outbreak in New York City in 2018, 2019, and it was affecting the Orthodox Jewish, like the Hasidic community,
Hmm.
like I'm not the trusted messenger for that, right? And so like recruiting someone on my staff who was from that background, and also then working with
Hmm.
community organizations and people that serve that community and are trusted, like that is like the magic of public health, where it's like you don't have to do all the work, you just have to be really good at providing the resources to
Yeah.
people who can do it. And so I do think that like it's true that when you see yourself reflected in the folks that are doing the work, it creates a different alliance, like a different trust.
Yeah. We leading that response to measles outbreak and to COVID in New York City.
Yeah.
What was the scariest moment in the early response for you from your position while you're leading the response to those outbreaks?
Yeah. I mean, so I'll be honest, with measles, I was never that scared,
Hmm.
mainly because like we have the technology, right? Like we knew how to prevent measles. We knew that there's a vaccine that works. Like, and we also, knew that the thing that we had to deal with was addressing like the mis and disinformation that was purposefully targeting the community. And that's a lot
Yeah.
of work, but it was not like scary. Like I wouldn't, it wasn't the same kind of scary. I'm never forgetting the feeling of COVID. Because that is, I think, is like one of those like personality defining moments, like
Yeah.
defining moments for me as a human, not just as a professional, of what it was like in like January, February, where in 2020, where we didn't have COVID testing, but we did have our public health surveillance systems. And I remember this moment of, not having testing for people, but seeing that using the surveillance that we had in New York City, we were able to see that there were a lot of cases of people with respiratory illness coming to the emergency rooms, but that there wasn't an increase in any of the viruses that we knew. And I remember like that moment going like, it's not the flu, it's not RSV, it's not like the cold virus, it's nothing. But there's something here that we're not able to measure.
Yeah.
And I was like, that moment of going, this is here. And every moment that we don't move to do something means more people will be sick. And then some of them will end up, dying.
Yeah.
And so like, I'm never forgetting like that sort of realization right there where you're like, COVID is here, and not being able to really prove it because we didn't have the testing, but knowing that we were right.
Yeah.
And then trying to sort of, impress upon, very well-meaning people who like led policy and government that like we had to do something drastic, even though we didn't have proof.
Yeah. Yeah.
It was a really hard time.
I remember that January, February, going to bed every single night and talking about trust in public health and our scientists. I remember just sending up like good energy to the universe, just praying, please, tomorrow be the day that they announce that they have a vaccine. Please be the day that that my parents are in the group that can get the vaccine. If we can just make it to that first group, then I can go to bed and rest easy. I will never forget from my perspective the amount of faith and trust in our public health officials and in our scientists and how important they were to getting through that.
I mean, like flash forward into December 2020, like I just remember, like what it was like. I had already left the Department of Health in New York City. I left that position in November 2020 at the very end. And, soon thereafter, the vaccine launched. And I just remember like, when it was time to be able to get vaccinated, like how, I went to like a stadium, like with the way that everyone else did it, because I wasn't in like a sort of, I was a free agent. I wasn't working for anybody. And so, just that sort of moment of lining up with like thousands of people to get this vaccine and seeing what it did. Like, I mean, I think that there's a lot of rhetoric around, the COVID vaccine doesn't work as well as it used to, but like, that's because we've now seen that virus and have been vaccinated so many times. In that scenario, when you have like a virus that people had never like experienced from the immunological perspective, that vaccine was like extremely effective in preventing COVID, both infection early, at the beginning, but then also the like terrible outcomes that we were seeing. So yeah, it was it's one of those big moments in public health that science was accelerated in a way that was like, ethical as well as rigorous to result in like a vaccine that helped end like the worst of the pandemic.
I want to get to December 2020 in just a minute, but I want to ask, when the vaccine came out, there was a lot of trust in it, and I feel like the misinformation that was out there wasn't as prevalent as it was maybe like 6 months later to a year later.
Yeah, that's true.
How does the misinformation campaigns and how does the conspiracy theories around vaccines, like where does that get started? Is there like, do you have a good grasp on how all of that begins, where it starts, and like what we can do to mitigate against that? Because I feel like just stating facts isn't enough to get people on board to understand that, okay, what you're saying is a lie. It's a conspiracy theory. And we can point it to where like that falsehood began. Talk me through that.
I mean, so I think that, the sort of skepticism again around vaccination in general, like has an origin all the way back to smallpox, right? You can draw a line that there was like, people who, I think, Ben Franklin famously was opposed to the smallpox vaccine. And then retrospectively, when his son died, he was like, I wish I had done it. So I feel like there's like a long history of like sort of that sentiment. And I think in the 60s, 70s, and 80s, like it became like a little bit entwined in some really important movements, right? Like sort
Yeah.
of got entwined in sort of the movement around like people having like reproductive rights. It got entwined into like feminism. It got entwined into all like very laudable good things. But the sort of, the tension between, vaccine and doing the right thing, not only for yourself, but for your community, like has always had some antagonism with the sort of, me-centric individual rights like debate, right? So I think that's been like a tension now for a long time. But I do think that COVID like definitely made it a lot worse, just because, for so many reasons, like a lot of sort of confusing communication, right? Like I think, it's important to say when you're right and when you're like not right. And I think that one of the hard parts was that, when the COVID vaccine came out, I think everyone said like, the COVID vaccine is going to, well, you will not get infected. Like there were very absolute statements that were
Yeah.
made around it. And I think that the lesson is that in science, there's nothing that's absolute. So always making sure that you are expressing some uncertainty is the right thing to do, even if it's politically not the right thing to do,
Yeah.
which is the right politically saying the vaccine is like the thing to do is, and it was the thing to do, but that it was like infallible or nearly infallible, I think is like sort of where we got to the place where, someone can say, well, you said that the vaccine was infallible, so you lied. And so I think that what's really important is to sort of think about pre-bunking misinformation
Yeah.
by being a good scientist and like being a good scientific communicator. So like the way that I like to think about science and misinformation is that if misinformation sets in, it's like an infection, it's like a virus,
Mhm.
right? But science is kind of the vaccine to that misinformation. And if you sort of are preemptive and sort of say, this is what I know now, that could change tomorrow. Like all of that sort of stuff ends up being really important. So it's not only about sort of communicating scientific information, it's also about the humility that you need to be clear that like something that you may say today may not be right the next day.
Yeah, I don't know why this just triggered my memory, but uh my best friend from growing up, she has a 1-year-old son, and he has this blood disorder where his body doesn't create antibodies, and so he has to go once a month to get infusions. And I don't I can't even begin to pronounce the words in which of the disorder that he has and what he's getting injected into him, but pretty much he's relying on these injections to boost his immunity. And through those
Sure.
injections, he's counting on other individuals to be vaccinated because since he has no immune system, he can't get live vaccines. And
Right.
and so when I've been talking to a lot of people in Alabama specifically about misinformation around vaccines, I'm like, okay, so pretty much what you're telling me is that you're okay with her son pretty much getting a deathly illness because you're too stubborn to get vaccinated. What I'm trying to get at is like when I bring it onto a human level to get people to understand the impact of their misinformation, like your misinformation isn't just something that you have read and believed. It's life or death for people, and the decision that you're making could kill someone.
Yeah. I mean, I think that, the challenge is I feel like we've always, as long as I've been in the US, there's, in my lifetime, I think that there's always been the sort of clear understanding that like, there's personal benefit that you get from vaccination, but then
Yeah.
there's also community benefit. And so, I think sort of folks who are actively trying to minimize the importance of the community benefit because it's hard to communicate in a world right now that's very focused on like the individual.
Yeah.
I think we're going to need to see like there, be a little bit of of progress back in the direction of understanding what the benefit is for everybody. I mean, I think your example is really good. I mean, there's so many folks who, for one reason or another, either can't get a vaccine or they get it and their immune system is such that they don't respond to it as well as others. And so, like not every vaccine is perfect. Not every vaccine, in fact, no vaccine is perfect in terms of preventing infection. But I mean, like, you still the odds in your favor for so many other things that you do. Like it's like, you know, it's a seatbelt that is not only protecting you from the accident, but protecting the entire community from
Yeah.
the accident. And so it's like, it's a little different sort of perspective on prevention. But I do think that, we do have to sort of remind people how important it is, especially for vaccines that are like, very, very good at preventing infection, how important it is that's like a part of our calculus for preventing infections in people that aren't able to, use these vaccines or have another reason they don't respond. It's like a key part of our vaccine
Yeah.
policy.
So I want to go back to you joining the CDC. So you joined in December 2020, and those were the final days of Trump's his first administration. What was the state of the agency like when you walked through those doors that December?
Yeah, I mean, honestly, like I feel like the part of the world that I entered was one that was benefiting from the first Trump
Really?
presidency. Yeah. So like I joined as the director of the Division of HIV Prevention. And the Trump administration, their two big public health victories that they seemingly don't care about anymore were one, the Operation Warp Speed to get the
Yep.
vaccine from an idea into actually something that we could give people. And the second one was the Ending the HIV Epidemic Initiative, which added like millions of dollars to the budget to be able to accelerate the end of the HIV epidemic using all of the resources that and technology that we had. So I was landing at CDC with like a new investment to focus on ending the HIV epidemic. So got to say that it was a hard time for public health during the sort of the pandemic. And I think that there was so much interest at CDC of sort of having like a renaissance and sort of looking at sort of the things, the good, the bad, and the ugly from the pandemic, and then translating that into like the future state of CDC. And I mean, I'll tell you that landing there in December, they were already on the path of sort of identifying like what went well, what didn't go well, and like what are the things that we need to do to make CDC like more resilient as an organization to be able to better deliver on the work. And I landed there like with excitement about looking at how to fix that, as well as like fatigue, right? People were really tired. Like they had been in like a massive pandemic level response for a long time, and they were still in one. And so I survived outside of the COVID environment for about 2 months at CDC before 3 months at CDC before they pulled me in. And so I really got to work, shoulder to shoulder with the people that were really so important in the beginning of the pandemic.
So you start at the CDC, you're excited. How long did that excitement last?
I mean, I never was not excited at CDC. I mean, like I'm not scared of hard work, and it's a hard place. It's there's lots of hard stuff that needs to happen there. And so I've got to tell you, the part that was like the hardest was that when I joined CDC as the director of the Division of HIV Prevention,
Yep.
one of the sort of agreements, like not obviously binding agreement, but an agreement that I had with my boss was that I would be protected from working in the COVID space for a few months so I could like understand like my job in HIV and like really start implementing some of the like ideas that I had. I mean, ultimately I got to implement them, but by March 2021, I got asked to be the deputy incident manager that was in charge of the vaccine task force in the US. So I went from like the epicenter as the incident commander for 9-10 months to like about a 6-week vacation, then started at CDC, was 3 months into doing like that HIV job. And then all of a sudden I was in charge of the vaccine effort for CDC for COVID. And so, that was intimidating because
Yeah.
I barely knew how to turn on my computer. And then all of a sudden, like I need to, like have a big organization perform well for the country. So I learned a lot.
What are you most proud of during that time?
So I think that probably in the COVID space, like during the time when I was in that, I think probably, because I mean, I have had like lots of incarnations. I think probably the successful launch of the first booster for COVID was probably like, at least in that era of my time at CDC, the thing I was the most proud of. I also think another part, some, hard things are hard. And I
Yeah.
think another thing I was proud of was, the communication of bad news around, the COVID-19 vaccine and sort of the finding that heart inflammation could happen in young adolescent males. And so I think that I'm also proud that like I got to work with CDC to communicate like, both the good news as well as the bad news around
Yeah.
the vaccine so that people could better understand like how to use that technology.
That is so, I mean, it's so refreshing to hear you speak on that, looking back, knowing that you, even the bad information, the things that might be hard for people to understand or to hear, the fact that like that transparency was a part of your mission and your game plan, that you're most proud of how transparent you were in that information. That is, given where
Yeah.
we are today, hearing that is, it's really good to hear that there were people who are good at their job and transparency was at the center of their work.
Yeah, I mean, this is like those lessons from HIV. I feel like, one of the things that's really important is that that anything that's not like transparency, even if it's imperfect, right? Like there's, I think that that's like the other part. Like not everything is perfect, but sort of, living through like, there's a safety signal,
Yeah,
right? To like, how do we communicate that safety signal? And listen, I didn't 100% agree with some of the ways that we chose to communicate it. Like I wanted to have like a big health alert. And instead what happened is it was put into like other very important documents that were transmitted to the world.
sure.
Either way, like the information got out and like learning how to talk to people, medical providers, public health experts, public health leaders around the finding, I think was really like instructive for me. And again, like I'm proud of how we did it and the fact that we got the information out and then just, continued moving forward, making sure that the policy reflected like both the benefits and the risk of the vaccine.
You said in a lot of different interviews that you are actually optimistic when this new administration came in. What you're telling me about that December 2020 timeframe with what the Trump administration was doing, the success that you had with the COVID vaccines, is that the reason why you're optimistic? Where was that optimism rooted in when the new Trump administration came into office?
I mean, I think, I worked at the White House. So I
Yeah,
got to do some time at the White House with the national mpox response. And so it was I got to sort of look into like the executive branch. And like one of the things that always, gave me hope is that, when people are given the responsibility for the whole country, sometimes what happens is like ideology and partisan stuff, like although maybe will be visible on the surface, disappears in the back because like the intent of the executive branch is to do right by people.
yeah,
And so I sort of had that, understanding that there was like a lot of rhetoric. Like I'd seen rhetoric and I knew that there's like rhetoric and then there's action. And so, I was optimistic in that, the track record of the first Trump administration, like included these two, towering achievements in public health. The again, like the Operation Warp Speed and the end of
yeah.
the HIV epidemic. And so it's like, people can say what they want, and I may disagree with like a lot of the rhetoric, but like at the end of the day, if they're doing like good by people and good by science, like so that people can get what they need, I think there's hope. I mean, I was pretty, like everybody was pretty concerned when they named RFK Jr. as the
Yeah.
person who was going to be the candidate for the Secretary of Health. But I also like, had this, belief that when the burden of actually the role goes on someone's back and they realize like the heft of what they're dealing with, that sometimes like the weird stuff goes away. And unfortunately, that's not what happened. So I
Yeah.
think, in other words, like if you're responsible for the health of children in the United States, like it would be weird, in my opinion, to sort of do things that would, destabilize the vaccine infrastructure and then result in people not being able to or not trusting vaccine to get or not trust vaccination, or like working against medical providers that were trying to do it. So I in my head was like, that's not what's going to happen, even though that's what his books are about. And so, when he came to HHS, I watched the nomination, the congressional hearings, and was concerned that he was saying things and wasn't very well prepared. But when he came to HHS and he had his first welcome address, and he sort of said, don't make assumptions about me because I'm coming here, and I'm holding my assumptions lightly so I can work with you all, work with the scientists, and we can chart a path forward to making America healthier again. And so to a public health person, you're like, I can work with that, right? If someone wants to work with me and let us present information and present data and have, discussions and debate, that's why we are all signed up to be leaders in public health. That's not what happened.
Yeah.
And so that's where my optimism was checked by reality, which is that we had the secretary had no interest in talking to anybody. He was, going to do what he wanted to do. Whether the data demonstrated that it was the right thing to do or not. And generally it did not demonstrate that what he was doing was the right thing to do.
Yeah. How do you work in that environment? How do you stay mission focused and still do what you need to do when that's what's happening?
Right. So career public health servants know how to do this.
Yeah.
Right. And so, I know that this administration constantly refers to deep state this and deep state that. Yeah. That's expertise knowing how to actually make the system work. And so what I would always say is they would do all this crazy stuff. And you're like, if they spoke to us as people who knew how to use the system, we would be able to direct them on how to do this in a way that achieves whatever their goals are while also preserving public health. And so, we really took the position, or all of us took the position that, we would work with them, but then we were ultimately also mitigating some of their bad decisions that were frankly often not feasible.
Yeah.
Maybe not legal. And so there was a lot of that. So I think that working in the environment, what used to be an environment where you were able to sort of be creative and change things became an environment where we were managing stupidity.
Yeah.
Frankly. And so that's what we were doing. And so he announces that, pregnant women shouldn't be, or pregnant people shouldn't be getting the COVID vaccine. None of the data supports that. And so what do we do? Well, we're fine, we can change the schedule, but it still says that pregnancy is a risk factor for COVID, and they should get the vaccine. So because they don't know how to govern, there you go. They didn't do anything. They thought that they did something, but they didn't actually do anything for access. Saying that kids shouldn't get the vaccine if they're healthy, we were able to sort of mitigate that. And instead of writing in the schedule, healthy children shouldn't get the vaccine, we said that there should be a discussion with children, which already with their parents, which already happened anyway, around whether or not they need COVID vaccine. So we were literally just mitigating the harms that they were creating.
Yeah. One thing that really shocked me when RFK came into his role at HHS was how so many people here in the South, they wanted to completely just shit on vaccines, and they wanted to read conspiracy theories and believe them. But then the second RFK said something along the lines of pregnancy and the COVID vaccine or Tylenol, it's the second that he would release a statement on it, they wanted to believe him, and they did believe him. I'm like, how? Yeah. How? I'm still at a loss, and I could get I want to get a PhD in understanding how RFK came to be their poster child for health. I do not understand how that happened.
Yeah. I mean, I think it's, I don't have an answer, but I do think that, there are certain issues that there's a lot of alignment between him and some of the other like more like conservative elements of
Yeah.
government and sort of, people in the US. The hard part is that the very areas that seemingly support him are the areas that are going to be the most impacted by his policy decisions.
Yeah.
So like rural America, their hospitals are going to close, right? Like, and that's just the reality of it. Like, the vaccine access is going to be like most impacted in that part of the country. So I think that there's like something to the fact that what he did was successfully politicize something that shouldn't be politicized.
Yeah.
And I think that we're going to have a long time trying to unwind this, but the sort of, you know, defining characteristic of a good political person is that they're able to stimulate excitement and alignment in populations. And so, though I wouldn't call him an expert politician given his track record for elections, I would say that he has learned enough around politics to figure out how to weaponize the public health into something political. And I think public health always exists in a political space. That's normal. That's the fun of it, because you learn how to sort of take science and speak political to make sure that you're making sure that the public health is being served, while you're also working with folks that may not understand it but have like the policy power to be able to implement the things that the science indicates. I think what you saw in this circumstance is saying, I don't trust experts, you shouldn't either, like experts are not a feature of democracy. What does that mean?
Yeah.
Like, and so I think that's what happens when you have like a couple people who can write a couple of good talking points for you. Let's face it, he has two good talking points. We're going to be radically transparent and we're going to give you gold standard science. And then he says it, and then the next thing is exactly not gold standard science and quite the opposite of transparency. So I feel like that he's done a very good job of weaponizing public health into a political tool.
Yeah.
But it also is backfiring on him. So
Sure. He talking about radical transparency. He's saying he's talking about radical transparency, but then there's policy changes that you said you found out on Twitter. Both no scientists were consulted on. You had no idea that these changes were going to come, but you found out on social media. What are some examples of those that you found out on Twitter that they were changing the policy on?
I mean, the COVID policy was a tweet. So I was, I remember I was in a meeting with all of the senior leaders at CDC. We had a weekly meeting, and it was with the political appointees. At that point, we didn't have anyone as really acting CDC director, which is another interesting conversation. And like my phone blew up. Like I was sitting here with my phone, and this same phone right here, and it started buzzing, and it said, did you guys change from a lot of people, did you all change the vaccine schedule for COVID? And I was like, I don't know what you're talking about. And then someone sent me a tweet, and it was from, I think, the HHS account. And it was a video of Dr. Makari from FDA, RFK Jr., and Dr. Bhattacharya from NIH. And, in a 2-minute video, they announced that they were changing the vaccine schedule, that it wasn't indicated for healthy children or for healthy pregnant women. And so I left the room and listened to the video, and that's how I heard that something had happened. And like, I went back in the room and I said, did anybody hear this was going on? And I mean, I don't believe the politicals. I think a couple of them were lying, frankly, but no one else had heard anything about it. And those politicals are not scientists. So there was no consultation with CDC. And then like Chad, the part that was really great is they were like, change the schedule. And, we were like, okay, send us paper, send us something that says what the schedule should be. And they go, just watch the video. And I said, no. I'm like, we're not changing anything based on a video. Like they have to send us like something in writing that is official, that says that the secretary is having us do this. And then they sent something 2 pages long, grammatical errors, and also not correlating to what they said in the video. They wrote something different than what they said. And so, you know, not my problem that they're messy, except that it was my problem because I had to sort it out and figure out how to like implement the craziness with my team, even though they couldn't even get their recommendations straight.
I have to ask, and this is like kind of like the tea of it all, but what was everyone saying behind the scenes to each other? What?
Yeah, it was like a lot. The main power that they have is shock and awe. And so like that was like one of our big first shock and awes. We had so many that eventually everyone
Sure.
got numb to it. So I think that the first thing is like, well, that's shitty. Like the guy who like stood up and said, I'm going to engage with you and like we'll chart a new path, like didn't do any of that, and decided that a Twitter post was better than any kind of communication with the scientists that actually hold the data that should have been used to make the decision. Not sure where he was getting his data from. So I think the people inside, I mean, frankly, like when we got the written paper that was different than the video, I mean, at that point, the first response was laughing because like if you can't even get your announcement right, we should trust you with anything. Like
Exactly.
this is
Yeah.
like one of the biggest things that he was going to do in vaccine to date, and like it was screwed up. It was like badly done. So people
How,
were like a little bit like they can't even get this right.
I mean, I know you're a scientist and y'all are professionals in your respective fields, but how do you take something so botched and work through it and implement what it is that they're trying to do?
Yeah.
Like I'm like
This,
trying to get behind the morals and ethics of it because I'm like, if it's
yeah.
that,
This
how?
is like what the career, like as a career, like what we did is we mitigated it. And so like we kept demanding, like we're not going to put anything up until you tell us exactly what you want. And so it took them 2 days to be able to tell us like different pieces of different people in the secretary's office. So the thing that they got wrong was they said publicly that there should be only like no healthy pregnant women should be getting the vaccine and like what they sent us was no pregnant women should be getting the vaccine.
Yeah.
That's not the same thing. And so, we asked their office, we had one person saying, oh no, it's only healthy pregnant women. Another person saying, no, no, it's all pregnant women. And it took us like 2 days to get them to decide what it was. And so that's not how you want your vaccine policy for the
Yeah.
country done, fast and loose. And it was fast and loose. And so like what we did is like, took advantage of the fact that they were crappy at their job. And so, we were able to, instead of putting up something that said like no children, no healthy kids should get the vaccine, we're like, we'll just say that it should be a discussion. And then like point to the things
Mm.
that would support, broader vaccination. And with the pregnant women, like we had no choice. Ultimately, they told us, secretary's decree, you need to say that no pregnant women should get the vaccine. And so we didn't do that because it didn't make sense. So instead, we just gave it a blank recommendation. And then other documents at CDC say that pregnancy is a risk factor for COVID. And so, like, we were able to sort of, take it from what sounded like a terrible thing to something that was like mitigated, where at least from the perspective of vaccine access, people were still able to get the vaccine if they wanted it.
Yeah.
But I mean, but that's like the thing, like, when they fired all of the ACIP members, like, I came pretty close to quitting then, but I was like, well, let's see what we get. Let's see what the new membership is like and see if we can work with them. And then like that was a disaster. And that's like actually the thing that really led to, that led to my decision to leave when like they sideline CDC people were going to create some weird advisory committee for immunization practices that like didn't actually wasn't going to do its job and they wouldn't listen to science. Like that was the beginning of the real end stage of my career there.
So you resigned in August of 2025, right after the ouster of the CDC director at that time.
Yeah.
What was the moment? So you said that led up to your decision. That was a piece of
Yeah,
it.
I
But
almost quit. I almost quit before she quit because of the fact that they were changing the advisory committee for immunization practices. And then they produced this crazy document that said like, that CDC people weren't going to be involved in setting the agenda. CDC people weren't going to be involved in who was going to be on the work group, so they could pack it with whatever people they wanted to pack without any feedback. They had this line that like the members of the ACIP were going to be in work groups to make sure that CDC bias didn't enter the discussion. And I was like, this is crazy. And I came pretty close, but Susan came in and I had like great meetings with her. And
Yeah.
she had like a really good idea for pathways to be able to mitigate what was going on, to sort of bring some order into the environment. I was like, amazing. This may be something that we can work on like as careers to figure out how to like, even though there's crazy, how we can sort of like temper the crazy and still have good things happen out of the government. And then when they pretty much told her, like, you can't be involved, like, I remember she called me. No, that's not true. I called her because I had to meet with one of the members of the ACIP who was particularly like unpleasant. And I just wanted to let her know that if he offered me thoughts and prayers for us being shot at, that I was going to tell him that he needed to keep his thoughts and prayers. We didn't want them because he was partially responsible for the shooting
Sure.
because of the misinformation that he spread. So I wanted to get permission from her to be like, I'm going to be very professional, but I'm also not accepting any of these thoughts and prayers.
Yep.
She was like, be nice, but do what you got to do. And then she said, by the way, the secretary's office told me I'm no longer to be involved in any vaccine decision making. And I was like, that is the beginning. That is like when I saw the writing on the wall. And so, when she resigned, or sorry, when she not resigned, when she was ousted, like all of us, the three of us, Deb Howery, myself, and Dan Jernigan, like there was, without that scientific leadership, we had unopposed like secretarial interference that was designed to just do bad things. None of us could in good conscience stay there.
I have to like be a little woo woo with what I'm about to say, but do you think like part of that plan was to get people like you out of the CDC? Like they knew that might be the line that would get everyone to resign?
I mean, I feel like yes, but I also feel like they maybe didn't expect for us to go out as big as we did.
Mm. I mean, yeah,
Because
your resignation letter it went viral, and you said that the CDC as we know it is over. It's going to take radical change. Like, do you still believe that the CDC as we know it, as this trusted public entity that people could look to, like it is still like there's no saving that?
yeah, I mean, I feel like if the political will is for destruction, and that's what they're doing. I mean, like, look at the president's budget just came out. They cut the budget again by billions of dollars. Like, they don't care about the place and don't care about public health,
Yeah.
seemingly. And so, like, I feel like all this energy trying to repair the ruin needs to be focused on like creating the next public health and not on trying to repair a thing that's like really just ongoing destruction. So I think that there's like things at CDC, like structures that are going to be around. And I think that the scientists are amazing, the ones who have managed not to feel, not to be compromised by the agency, are great. But I do think that trying to like patch holes is not going to be the right answer, because that's how it was so easy for this administration to tear down public health in the
Yeah.
country.
Yeah.
So I think it's like, Control Alt Delete, start over.
So when you say radical change, that's kind of like the radical change that you're speaking of, like just start over.
I mean, if I were, if someone asked me, like I would say that like the next HHS secretary, like meaning in an administration interested in building public health, should really look at like the way the whole thing is organized. Like there are other places that have sort of more regional, public health like power, and then like the federal public health entities in the service of the regions. Like I think that this like localizing it in sort of one place that is so easily destroyed means that our country is less resilient and prepared. So I
Yeah.
think that there's like needs to be, an intentional redesign. Public health, like CDC, so much of its like evolution has been based on like emergencies.
Yeah.
Like something happens, there's money that comes in, infrastructure gets built. It's kind of like, those buildings that you go to that like the second floor walks you onto the fourth floor, and then you keep walking on the fourth, and now you're on lower level because they built all the buildings in different eras
Yeah.
and it's not actually cohesive. That's kind of CDC. So it's like if someone wants to send a wrecking ball through CDC, then great. Like, but then build it with intention the next
Yeah.
time. Don't build it based on like emergency one, emergency two, problem one. Like, so like, what is the intentional design that we need out of public health rather than the one that we've gotten because of like evolutionary pressures that we can't control?
Yeah, I appreciate you saying that because in Kamala Harris's book, 107 Days, she was talking about how like don't lose sight of the moment. Where if and when we win the White House again, this isn't the change that the country needs. It's not going to happen overnight. This is going to be rebuilding that takes years. And it was very theory and how she was explaining it, but listening to you is kind of putting an example to that theory. Take the CDC. It's going to take rebuilding from the ground up, and it's going to take intentional effort to build it back and to make it better and to be stronger than we were before. It's not something that we can just reignite. Like it's been destroyed. We have to rebuild, and it's going to take a while to get there.
I always say, like I give some talks around about this, and I'm like, every time that there's a golden age, eventually it's followed by a dark age, and then eventually a renaissance, right? And so
Sure.
like you don't, you don't try to patch the Acropolis, right? You build the Sistine Chapel, right? You have to be like, oh look, this is the thing of how it was, and it didn't work out in this environment. So let's envision something different. And again, like it's about intentionality. It's like, what do we actually need out of public health rather than like, this is what we got, let's make the best of it.
Yeah.
There's a difference there.
Absolutely. And as we're seeing this national public infrastructure just be destroyed right in front of us, there seems to be a level of focus and importance on community level public health. Why is that so important for people to be paying attention to right now as we move forward in this new Trump administration?
Yeah, I think that in general, like HIV lesson, back to the beginning of our
Hmm.
conversation, is that like when political will isn't present, then community action is the thing that changes public health. And so I think that the and that is broad. Like I don't just mean like community-based organizations or activists. I also mean like local public health. Like let me tell you, those local public health people, like there's a vacuum over them with so much of what's happening at CDC and HHS, and they're carrying the water
Yeah.
for the entire country because they're taking it upon themselves to make sure that they're giving the people that they represent like the best information that they can. And so it's like, the role of community is like not to be underestimated, because it really is like where I think we should be making our future investment. It needs to be deeper down, not higher up,
Sure.
because it's too easy to destroy down up there. The people that really know what the priorities are for their population are the people at the front line. So empower them so they have like both the authority to do it and the accountability to their people for when it doesn't work right.
So the next question's twofold. I'm curious for the listeners who they want medical information, they want public health information. You can't really
Yeah.
trust the CDC or what's coming out of the administration right now. Where can they look to get accurate, up to date information? And then what can we do as individuals to support the community public health initiatives right in our backyards? What does
So I
that
have
support
like
look like?
great. I have a couple level answers. So like,
Sure.
and one of them is like a great answer, but then also has like a depressing part, which is like talk to your clinician, talk to your doctor. Like, because like right now, they're the ones on the front line who are differentiating the signal from noise. Now, the problem is not everyone has a doctor. And like the environment, the policy
Sure.
environment is such that maybe fewer people are going to have doctors because of what's going to happen with Medicaid and in insurance and all of that. So then the next layer I would say is to like look at your local public health department. I think that very often they really do a good job of trying to communicate things, and many of them are communicating in a way that is independent of the misinformation coming out of CDC. And then another place to look are, frankly, like the professional organizations that represent your doctors or the doctors. So like thinking about things like the American Academy of Pediatrics, the heroes of the day, the Infectious Disease Society of America, the American Family Physicians. Like there's just a long list of organizations that I think are doing a really good job of putting out information that people can understand. So I think that it's, I think ultimately the answer is, well, let me give you what the answer isn't. Like if someone is offering you a coupon code to buy something on the internet because they're an influencer that's sort of trying to promote something, that's probably not the person you should listen to. Just saying.
Yep. Heard. I want to ask, I want, we're in the final two questions, but a lot of what we're talking about is so dark and it's heavy. And we're in a time right now where it is hard to see the light. So I'm just curious from your vantage point, what's giving you hope?
I think so. Community, like I go back there because, and I mean that broadly, not just like, my neighborhood or whatever, but, when I was, I came to New York, like I said, in the 90s. And, by the time I got into medical sort of work, it was the mid 90s when I started medical school. Like a lot of the activist things that were happening, all the big things had already happened for so much of HIV. And I always sort of like thought community meant one thing until like I realized what happens when community is threatened. And then you actually see like how powerful it is. So I get a lot of hope out of community. And I mean that like people, I mean like the community of scientists and doctors and medical providers and nurses who are just going like calling the BS out, I think is, like that's the thing to not lose and to harness, because like we need to keep doing that even when things are good, and that needs to be empowered. So I think that that's the thing that gives me the most hope.
I always say the B storyline to He's Not Wrong is the impact and the importance and the focus of your local community. If you want to make actual change, focus on the local community. And you just brought that up without me having to prompt you. And I am so appreciative because the B storyline lives once again on He's Not Wrong. And I mean, you brought it up so eloquently, so perfectly. You need to focus on your community.
I decided to leave up there and go and work at the front lines in New York City because like this is where I can affect change. And so like that's like lesson learned.
God, that's so beautiful. And listen, we made it to the final question. I ask all my guests this at the end of an episode. It's, what are you not wrong about? So Demetre, please tell me, what is it that you are not wrong about?
I'm not wrong to have hope.
There you go.
I'm not wrong to have hope. There's reason to hope.
It's like I said, it's a dark time. You don't need me to be the one to say it, but it is so easy to lose sight of that light and to lose sight of that hope, and to see someone at your level doing the work that you're doing, who has seen the things that you have seen and experienced, to hear someone like you say that you have hope. That is so powerful and it is so meaningful. And I'm so thankful and I'm grateful for your time today. Thank you so much for coming on and sharing this message with us.
Thank you for having me.